A butterfly is a miracle, a divine creation. Who doesn't love a butterfly floating around, colorful and free? But this beautiful butterfly has its flip side, called the butterfly effect. Even a small flutter can disturb the large complex system to such an extent that it can cause a hurricane. Same is true about thyroid, a butterfly-shaped gland. It may be small, but it has a walloping impact. As is thyroid, so are the other endocrine glands. Even a small flicker in their functioning can lead to agonizing conditions imitating a butterfly effect. The butterfly effect in endocrine system can lead to hyperthyroidism, obesity, PCOS and infertility, gestational diabetes, PMS and hyperprolactinemia. To mitigate the butterfly effect, Montana and Venus, divisions of Aries, extend their hands by offering solutions for issues related to reproductive endocrinology. Introducing Carol for hyperthyroidism, Orlean for obesity, Carpella for hyperandrogenism, Medital for PCOS, G75 for accurate screening of gestational diabetes, Rupactin for hyperprolactinemia, and Iridiol for post-menopausal syndrome and thin endometrium. Hyperthyroidism is associated with menstrual irregularities, thereby reducing fertility. It also affects the developing fetus in TPOAB positive pregnant women. Furthermore, it is associated with pulmonary hypertension, worsening of diabetes and osteoporosis, thereby disturbing harmony in life. In hyperthyroidism, prescribe Carol, the brand of carbimazole. Carol restores harmony in life. With Carol, euthyroid is achieved within 4 to 12 weeks. There is significant improvement in total symptom score, pulse rate, weight, and SHBG level. In hyperthyroidism, prescribe Carol. Carol restores harmony in life. Carol assures resumption of ovulation and regular menses, thereby improves fertility. Carol also assures restoration of cardiac manifestations, improved bone mineral density, and re-establishment of glucose homeostasis. In obese and overweight patients, prescribe Orlean. Orlean contains orlistat that cuts the fat, cuts the risk. Orlean cuts the weight by 8 to 10%, thereby cuts the risk of diabetes, hypertension, dyslipidemia, and infertility due to PCOS by restoring ovulation and regulating menstrual cycle. In androgen, excess-mediated menstrual disturbance, hirsutism, and acne, choose the strongest anti-androgen combination. Prescribe Carpella brand of cyprotron acetate and ethinylestradiol. Controls androgen excess in PCOS. Carpella increases SHBG levels, blocks androgen receptor, reduces the ALH-mediated androgen production, and offers greater reduction in acne. As per the Journal of Clinical Endocrinology and Metabolism, Central Asians have severe metabolic phenotype associated with insulin resistance, central obesity, and metabolic syndrome. For insulin resistance associated with hyperandrogenism in PCOS, prescribe Metital. Metital corrects insulin resistance and normalizes ovarian function. Metital offers synergistic effect of metformin plus myoinositol. Metformin in liver reduces gluconeogenesis and increases SHBG. In ovary, reduces hyperandrogenism, and in pituitary, regulates LH, FSH ratio, thereby correcting oligoovulation anovulation and menstrual irregularities, whereas myoinositol in skeletal muscle and adipocytes increases glucose uptake and adiponectin. Thus, metotil reduces insulin resistance and hyperandrogenism. For insulin resistance associated with hyperandrogenism in PCOS, prescribe metotil that corrects insulin resistance and normalizes ovarian function. As per Journal of Human Reproductive Sciences, metotil showed 100% improvement in menstrual cycle, regularization and complete recovery of acne and hirsutism. 1 in 5 women in India suffer from GDM. WHO recommends universal screening of gestational diabetes with OGTT by giving 75 grams anhydrous glucose and measuring glucose levels after 2 hours. For accurate screening of GDM, prescribe G75 sachet. G75 setting standards in OGTT. G75 provides accurate recommended dose of 75 grams glucose for OGTT. According to FOGSI and DIPSI guidelines, first test should be done on first ANC visit, second test in between 24 and 28 weeks of gestation, and third test in between 32 and 34 weeks of gestation. In hyperprolactinemia disorders, prescribe Rupactin, regulated prolactin levels, recommended as first choice in the treatment of hyperprolactinemia as per the Endocrine Society and American Academy of Family Physicians. Cabergoline in Rupactin reduces prolactinoma size by 90%, suppresses galactorrhea better than bromocriptine, and offers easy dose titration. Cabergoline in Rupactin normalizes prolactin levels, menstrual cycle, and restores ovulatory cycles and fertility. For ensured estrogen support, prescribe Iridiol to restore her estrogen levels. As per Journal of Obstetrics and Gynecology Research, an addition of EV estradiol valerate into the CC-clomiphene citrate cycle significantly improves endometrial thickness. 91.9% decrease was observed in mean hot flash score in the EV estradiol valerate group versus 60% in isoflavones after 24 weeks of treatment, as per study published in Gynecologic Endocrinology and Reproductive Medicine. Iridiol contains estradiol valerate, which suppress bone loss in premature menopause, perimenopause, and menopause. It is highly effective for vasomotor and vaginal symptoms in perimenopause and menopausal women. To mitigate the butterfly effect in endocrine system, prescribe Carol for hyperthyroidism, Olean for obesity, Carpella for hyperandrogenism, Metotil for PCOS, G75 for accurate screening of gestational diabetes, Rupactin for hyperprolactinemia, and Iridiol for postmenopausal syndrome and thin endometrium.